Physician-assisted suicide is a very critical component to our medical morality as a nation. It allows those to choose their own death willingly. This seems too superior to be imposed upon humans as an option of life. An article written by Dougherty et al. States that, quote, the criteria can be challenging to establish where the primary condition the person is seeking relief from is a mental illness, and research has recently attempted to identify how the criteria of irremediable suffering is met, unquote. In simple terms, the quote comes from an article that investigates how it is measured and proclaimed someone is unwell enough to be a candidate for physician-assisted suicide. If one was diagnosed with cancer and it was a terminal illness with expectations to live 3 to 6 months, would that prognosis be enough to be allowed this decision of physician-assisted suicide? Well, then, would someone with severe mental illness be allowed to end their lives if they would have been deemed unwell enough and wanting to commit suicide in the next 3 to 6 months? In what terms would they justify the standard minimum amount of pain, whether it be mental or physical, in order to qualify for physician-assisted suicide? Especially when there is such a vast amount of diagnoses that this could apply to. If this was to be enacted, at minimum there would have to be some form of standardized scale to measure the qualifications to be approved for physician-assisted suicide. This could easily be misused and cause a deeply ingrained form of corruption in the medical world like we have never seen before. An article from Wang in 2022 states that, quote, psychiatric illness can be shaped and sustained by the social environment. It raises the concern that the provision of psychiatric medical assistance in dying may lead to people from socially oppressed groups seeking aid for suffering that is partly constituted by an unjust social context, unquote. Applying the same logistical context to any of the factors that affect mental illness, such as poverty, trauma, or even substance abuse, shows that physician-assisted suicide is not appropriate in the medical field. We already have medical procedures and treatments in place for those with terminal illness in order to make passing less painful. This includes strong pain medications that eliminates the pain of a failing respiratory system or any other pain symptoms, medications to dry up secretions that can cause discomfort or panic, antipsychotic medications for anxiety, as well as patient-specific medications depending on their symptoms. There are also a vast amount of different medical procedures and technology available in order to assist and make death less painful. Physician-assisted suicide is an example of extreme measures taken for judgment that is not standardized or tested for proof of accuracy. The distinction for qualification is very blurred and unclear. The introduction of physician-assisted suicide leads into the possibilities of misuse and mistrust within the healthcare system, and that is why you should vote negative to physician-assisted suicide.